Hello, I'm student nurse Bernice, and this video is a demonstration of the intrapartum and newborn care practice. We have a 28-year-old pregnant woman with gravida 1 para 1 presented in the delivery room at 38 weeks of gestation, and the cervical dilation is 7 centimeters. The woman complains of a very strong contraction. I've checked the patient's vital signs, and the BP is 130/80 millimeters of mercury. The maternal pulse rate is 90 beats per minute, and the temperature is also 37.5 degrees. That's low-grade fever. Hello, Mom. Mom, please, are you comfortable in this position? Okay. So your vital signs are stable, and also you are doing well. Your cervix has dilated to 7 centimeters. Upper. Mom, please, before I transfer you to the delivery bed, do you want to eat something or drink something? Please, do you want to use the CR? Okay, thank you. Then now I'll transfer you to the delivery bed, Paul. Okay, thank you. So now I've transferred the woman to the delivery room. So the next thing I'm going to do is to check the room's temperature. The importance of the room temperature is to prevent hypothermia, both in the mother and in the baby who will be born. So if you have an appropriate device to check for the temperature should be between 25 to 28 degrees Celsius. But since there is no device, we are just going to do it in the manual way. So how? I'm going to throw this in the air, and when it falls down just here, that means there is no air draft. But if it blows away, that means there is air, and I will have to eliminate the air draft. How? Maybe by closing the doors and the windows. Yes, so let's do this. Yeah, so the paper fell just right here. It did not blow away. So the room temperature is okay, and we can proceed. Hello, Mom. Please, are you okay in this semi-upright position? Are you okay? Do you like it? Are you comfortable? Okay. So now I'm going to provide privacy by maybe drawing the curtain or closing the door if it is necessary. So after that, I would have to remove all my jewelries. I'm going to do my hand washing based on WHO 123 protocol. So this is going to be the resuscitation area. So I would have to check the equipment and make sure that they are clean, and also there is no fault in it. So this is the U2 tube, and it's new. This is going to be the laryngoscope. This is going to be the suction bulb. It's empty, there is nothing in it, and it's new. This is going to serve as my oxygen bag and the mask. And this is the blanket. So I've checked, and there is nothing wrong with them. So in case there's any complication or when the newborn should go unconscious, this is where we will resuscitate the baby, and these are the equipment we are going to use. Actually, a resuscitator is a device that uses positive pressure to inflate the lungs of an unconscious person who is not breathing in order to keep them oxygenated and alive. And there are so many types of resuscitation equipment and accessories that assist in providing oxygen to the individual or the patient. So these are some, because this one is newborn, these are the ones that we will be using in case of any complication. So I've prepared the materials and equipment for the delivery and the newborn. So I arranged them in a linear sequence so that it will be easy to get them. This is 3 pairs of gloves. One will be used to clean the patient's perineum, one will be used during the delivery process, and one will be used to cut the umbilical cord, if ever. The nurse, if ever I'm the same person who is going to cut the cord. And these are the 2 liners. This is the bonnet. This is the plastic clamp, the scissors. This is going to serve as my eye ointment. This is vitamin K, hepatitis B, BCG, and this is oxytocin. This is oxytocin, 10 units. This is 2 kidney basins. And these are the cotton balls, the thermometer, and the alcohol. So they are already enriched. It's easy to get them. So I've worn my first gloves. I'm going to clean the patient's perineum. So I have my antiseptic on the cotton. So I'm going to open the labia majora to expose the labia minora, because you will be cleaning from the inside to the outside. So, and we are going to give it a 7 strokes, 3 on the left side, 3 on the right side, and 1 in the middle. So we go like this. This is the inside part. So 1, 2, 3, you discard. Then 1, 2, 3, you discard. Then this one will be for the inside part. After cleaning the perineum, I'm going to discard this and do another hand washing and do my double gloving. So I'm going to do the hand washing. Okay, done. So I'm done with the double gloving, so I'm going to encourage my patient to push. Ma, push, push. Yeah, push. Deep breathe, breathe in, out, push, push, push. Okay, so as I will say just a little push, and I will drape the dry lining and I'll put it on the patient's abdomen. This is where we'll put the newborn baby. So after that, I will support the perineum. This is just to avoid any tear. So I'm going to support the perineum and I will control the delivery of the head. Okay, so baby out, baby boy, 6:30 a.m. Okay, so I'm going to clean the baby's face, and I will clean the head and the trunk of the baby and the other parts of the baby. As I'm cleaning the baby, I'll be checking for breathing. And how I'll identify this is the cry of the baby. After cleaning the baby, I'm going to remove the wet lining. And I'll place the baby in between the woman's breast so that they will maintain skin-to-skin contact. And I'll cover the baby with the dry lining and put the baby's bonnet on his head. The reason for maintaining skin-to-skin contact is to prevent hypothermia, and it's going to prevent infection and hypoglycemia. While the baby and the mother maintain skin-to-skin contact, I will be palpating the woman's abdomen to check if there is another baby inside. This is just to prepare the woman for the oxytocin injection. So after confirming that there is no other baby inside, I'm going to remove the first gloves. Because I did 2 gloving, so I'm going to remove the first glove in preparation for the cord clamping, because we don't want to promote any infection and contamination of the cord. So I'm going to remove the first dirty gloves, remaining the other one, then we will continue with the cord